Hi, this is Tracy from Aspen University doing my Module 5 video for Adult Health 1. And today we are talking about the eye. This is my diagram of the eye. I'm not an artist, but I did my best. So the first thing we're going to look at is the pupil. And the pupil is the opening of the eye, which lets light in. The light comes in and hits the lens, which reflects that light on to back to the retina, where the retina takes that, transmits it to electrical impulses and sends it to the optic nerve, which is part of the central nervous system, where and that's where the information is kind of determined. What are we actually looking at? We also have the iris. The iris is actually the colored portion of our eye, which I constantly call our thumbprint of our eye, and it also works as a protection as well. Right here we have the anterior chamber of the eye, where we have some pressure control, and the cornea, which works to protect the eye. Right outside the cornea, we have the conjunctiva, which functions to keep the eye moist and as well as protect it from any outside elements, and infections as well. The lens is held up by the suspensory ligaments, and the suspensory ligaments are attached to both the lens as well as the ciliary bodies. The ciliary bodies produces a moisture or something like that. It's called the aqueous humorous, and it works to provide nutrition to the eye, and I believe it provides nutrition to the there you go, provides nutrition to the cornea and the lens. We also have the choroid, which is back here, the sclera, which is the white portion of the eye. In some people, the sclera can be a yellowish tint, and these people that it's acceptable in are usually older adults because it has some depositions going in there, which kind of gives it a yellow tint, not to be mistaken for jaundice. Um, and so that's where we're going to just kind of leave it at that for right now. So we're going to go ahead and get into some of the common infections that we can find in the eye. One of the most common ones that I can think of is pink eye, also known as conjunctivitis, which is the inflammation or swelling of the conjunctiva, often caused by viral or bacterial infections, but is also known to develop from allergic or irritants such as pollen or pool chlorine. Treatment is dependent on the cause. Bacterial conjunctivitis is treated with antibacterial eye drops. Viral conjunctivitis has no treatment and it must run its course, just like the common cold. Allergic conjunctivas, it just requires the person to stay away from whatever is causing the irritant, and chemoconjunctivitis also requires some type of saline flush in the eye to get whatever is in it out. It's important for nurses to educate patients about medication use and self-care. This includes importance of hand hygiene, developing, avoiding touching the eye, not using other people's eye makeup, and reusing face towels, because then you're just kind of can transfer what's in one eye into the other, or just constantly put the same gunk in the eye. It's also really important to stress the importance for people to not wear eye contact lenses during the time that the eye is inflamed. Another common disease of the eye is retinopathy. Retinopathy is the process of microvascular damage to the retina, causing blurred vision and progressive vision loss. Retinopathy is often caused by one of the two, and possibly for some people even both, but diabetes mellitus and hypertension. Diabetic retinopathy is caused by capillary microaneurysms, retinal swelling, and hard exudates. Oftentimes, edema can develop and plasma can start to leak from the blood vessels. There's no treatment for diabetic retinopathy, only management. As long as patients control their glucose levels, it can delay or prevent any worsening of the damage that's already been done to the retina. Hypertensive retinopathy causes blockage to the blood vessels. It can cause swelling, retinal hemorrhage, and cottonwood spots, but have little effect on the vision. But it is noted whenever the eyes are seen by a physician that those spots are noted. In severe cases, patients can have sudden loss of vision due to swelling in the optic nerve and disc. Treatments for hypertensive retinopathy is often done on an emergency basis, and the focus on the treatment is to lower the blood pressure in order to prevent any further damage, and typically they're pretty successful at restoring the vision. It's important for the nurse to educate the patient on health management and connect them to resources that can help them manage their health. The last but not least that I'm going to talk about is AMD, which is age-related macular degeneration. It is an irreversible vision loss in people over the age of 60. It is caused by retinal aging, basically. Genetics and family play a role in this situation. Those most at risk are white people with a history of AMD, chronic inflammation conditions, smoking, and hypertension. There are two forms of AMD, wet and dry. The wet form of AMD starts with abnormal accumulation of yellowish extracellular deposits in the retinal pigment epithelial, causing degeneration of macular cells to occur over time. Wet AMD is characterized by the growth of new blood vessels in the abnormal locations of the retinal epithelium. As the new blood vessels grow, they leak fluid and can bleed, causing scar tissue to gradually form, which contributes to the degeneration and the vision loss. Acute vision loss may occur with either one of these AMDs. To treat the treatment for AMD involves slowing the process down with the use of vitamins and or multiple injectable medications. The cessation of smoking can help, as well as controlling blood pressure. And it's important to add that typically diet changes don't make a difference if you're not already predisposed or leading to the point of having AMD. So that's all I talked about today. I think I made it in time. This was my second take of the video and I got it in time. All right, hopefully you learned something and hopefully I didn't sound like I was rambling because I was talking so fast.